Today I'm going to outline my 7-step non-surgical lumbar spinal stenosis treatment protocol. If you've been diagnosed with lumbar spinal stenosis, this will be an important video for you. I've used these 7 steps of my neurospinal restoration program to provide thousands of treatments to help people like Lou, who was suffering from debilitating back pain and is now back to doing all his activities of daily living without pain and without disability. I'll talk more about Lou later in this video. In this video, you'll also learn how these 7 steps are all required to successfully address and treat lumbar spinal stenosis. And I will explain them to you in a simple and easy to understand way. You'll learn how I do each of the 7 steps and why. The second step is my favorite, but be sure to watch right to the end of the video for all 7. My goal is to provide you with a treatment guide that you can discuss with your treating doctor so you can make sure you're getting the best possible treatment for lumbar spinal stenosis. You don't want to miss any of these 7 steps for treating lumbar spinal stenosis without using surgery or drugs. This truly is one of the best and safest solutions for lumbar spinal stenosis. Hi, I'm Dr. John Zielonka. I'm a neurofunctional chiropractor in Ottawa, Ontario, Canada. I've been helping people for over 30 years now. I'm the author of 10 books, the founder of National Health Day in Canada, and I'm very honored to say we've been voted Ottawa's best 15 times. As well, I've had the privilege to work with some of the world's best athletes. My YouTube channel focuses on helping those who've been suffering with debilitating chronic back and neck pain. Before I dive into today's video, I need you to smash the subscribe button if you want to learn more tips and strategies on how to treat and relieve debilitating back and neck pain without drugs and surgery. And to tell me in the comments that you've subscribed, and I'll personally reply back to you. So lumbar spinal stenosis, very simply, is a narrowing of the spinal canal. Remember from our vertebrae from before, we want vertebrae, nice thick disc, another vertebrae, another disc, another vertebrae. The yellow guys coming off here are the nerves. They come right off the spinal cord. And it's the spinal cord that is inside the spinal canal. So the spinal cord obviously connects the brain to the rest of the body. The nerves shoot off that spinal cord, and that really is the hardwiring of your body's own computer system, so to speak. So in spinal stenosis, that canal actually starts to narrow, whether that narrowing comes from degeneration, whether that comes from shifting of vertebrae, whether that comes from disc herniations, but you're actually narrowing the spinal canal. This becomes incredibly important because when you mess with the spinal cord, you're going to affect everything. You're going to obviously pain, disability. You can get some serious and often life-changing negative consequences of your daily activities. So we're talking everything from chronic pain, emotional stress, difficulty walking, leg pain, leg weakness, especially difficult to stand and to walk for any long periods of time. When that happens, think of what that does to your overall well-being, to your mental wellness, to your lack of social life, to isolation and so forth. It affects mental health big time. It'll affect your family time. Absolutely, you won't be able to do things with your spouse or with your kids. Forget the idea of throwing your kids or your grandkids up in the air or doing any of the favorite activities with them. Also forget any of your favorite sports as well. It doesn't matter whether you're a hockey player or a skier, you simply aren't going to be able to do your favorite sport anymore. Now, this is why it's so important to have a step-by-step solution to this type of problem. Without the proper protocol, you're going to simply miss some of the underlying causes of the problem. And yes, it's always causes, it's never cause. People think they may have one thing, they always have multiple things. So with a step-by-step solution, the advantage of that is we're sure we're addressing each of the steps and each of the underlying causes. It's actually the reason that I've developed this 7-step protocol is that what we want to ensure that we're attacking each of the things that are creating a problem here. We've seen this with a lot of our people who actually came to our clinic is they had tried so many other things, and with all due respect to the other things, some of them may be great at giving temporary relief, but if you're still suffering with these things, you're missing a piece of the puzzle. And so a step-by-step solution, the 7-step protocol, allows us to see each of those things, and the success rate we're now seeing because of implementing a 7-step program is just remarkable. Now, I'll outline my 7-step protocol that we use specifically for lumbar spinal stenosis in just a moment. But first, let me tell you about Lou. Lou is a patient of ours who had significant spinal stenosis, 64-year-old man who came in some significant low back pain, significant pain shooting down the legs. He was diagnosed with lumbar spinal stenosis, also had sciatica, also had degenerative disc disease. He had tried everything from chiropractic to physio to massage, certainly a number of different medications, seeing medical doctors. Lou had actually had this for 6 years. In year 4, actually went for spinal surgery. Actually had a fusion done, and it still continued. So the surgery is what we call failed low back surgery. Still had all the significant pain. Lou's quite well known in the city of Ottawa, where he had to, be with clients often as part of his job. And imagine what this is doing to your ability to actually do your job, to pay the bills, to move up in the world. Any of these things at all, he was just affected all the time. Lou came in, went through a thorough exam with us, was placed on our 7-step protocol, and within a period of 8 weeks, Lou went from taking 15 pills a day, so that was 9 Tylenol and 6 gabapentin every single day for years. Understand what the Tylenol is doing to your liver, what these drugs do to you. The Tylenols, anything with acetaminophen is affecting the liver big time. Any anti-inflammatory is eating away at the stomach. These are not good to be used on a long-term basis. 8-week program with us, going through all 7 of the steps, and within 8 weeks, actually went from 15 pills a day down to 0 pills a day. 80% better at this point in time after 6 years of dealing with this, including spinal surgery. Within 8 weeks, went from a 9 out of 10 in pain down to 80, down to the point where he's now 80% better and taking 0 pills. That's why we've developed protocols like this. That's why if you follow each of the 7 steps, you can literally change people's lives. That's what we're looking to do, because a lot of people are out there, they feel they've tried everything, they've given up hope, and there is a solution to this. Now, here are the 7 steps that encompass my signature neurospinal restoration program. I'm going to give you the why and the how of what we do these things. The goal here is the more you understand about what's going on, the more you can make the right decision for yourself. So step number 1, always starts with step number 1, is what we call our comprehensive initial consultation and examination. That includes a full spine nerve scan, that includes diagnostic digital x-rays. The reason we do this, the why of why we do this is if we don't know all of the causes, then how on earth do you ever fix the problem? I know it sounds so simple, but far too many people think that they have one issue. They'll wait 6 months for an MRI, they'll come back and hear that they've got an L4-5 disc herniation, and they think that's the one thing, and all they need to do is fix that one thing, they think they're going to be cured. It doesn't work that way. That's one of the biggest things that we see in my health center, and we've helped many, many people to this point in time, is that it's always more than one thing. Because if it was just a disc herniation, for instance, then there is what's called a discectomy. You go in, you slice off that part of the disc, and theoretically you should be cured. If all you think you have are muscle spasm, then just go stretch and take some muscle relaxants and you should be cured. The reason people are continuing to live with this is they've never found all of the underlying causes of the problem. In my health center, on average, we're finding most people typically have 5 or 6 significant different things that are going on, of which most of them are unknown to them at all. So that's step number 1 for sure, is we need to do that comprehensive initial consultation, examination. We get hands-on with you. We do everything from orthopedic testing to a full spine nerve scan to, as I said, the diagnostic digital x-rays. We need to see the level of degeneration that's going on in there. And think about it, in most of these cases, there's pressure on the nerve where we need to know exactly where that's happening as well. Step number 2 is at the core of our program. It's what's referred to as non-surgical robotic laser spinal decompression. So again, let's take a look at one of our models here. It doesn't matter whether you've got disc degeneration or joint degeneration or osteoarthritis. They really all mean the same thing. It doesn't matter if that's a herniated disc in there. It doesn't matter if there's spondylolisthesis where the vertebrae have shifted, whether there's spinal stenosis where you're actually starting to enclose that canal. All of those things put pressure on the nerve. So what on earth makes more sense than to take pressure off the nerve? That's what spinal decompression is supposed to do. It is different than traction or stretching or inversion tables. Anyone who tells you that traction and decompression are the same thing, unfortunately, is not an expert in the field. Spinal decompression was actually invented by Dr. Alan Dyer, a PhD, a medical doctor, and former Minister of Health for Ontario. So this is very much a Canadian thing. Now, the reason a lot of spinal decompression still doesn't work is that when we start to pull that apart, what do you think the body wants to do is it says, well, hold on, we don't like that. It's going to resist, and it's actually going to stop you from doing that. Or it's going to go back, and you're going to get short-term relief instead of the long-term correction that we're looking for. So what true spinal decompression does is it actually allows fluids to come, it creates a vacuum effect. It allows fluids to come back into the disc. It allows nutrients to come back into the disc. It rehydrates the disc. It allows disc herniations to actually recede back as well. We've seen that on MRI in a number of our patients as well. Now, by adding robotic laser to this at the exact same time, we have what's called a class 4 laser that comes from underneath the system. And class 4 laser is the highest level of laser that's approved by Health Canada and the FDA. It's essentially going to do two things. Number one, it's going to ease up all those muscles so that your body doesn't resist. So you're actually achieving true spinal decompression and getting all the benefits we were just talking about. And number two, you've done damage to that area in there as well. A class 4 laser is going to help to heal that damage on so many different levels as well. Step number 3 is what I call our disc replenishment and healing protocol. Now again, let's start putting the pieces of the puzzle together. I was just telling you in step number 2 that one of the things that true non-surgical robotic laser spinal decompression will do is it actually draws nutrients into the disc. Well, unfortunately, what a lot of people don't realize, including most doctors, is they don't understand that the body's capable of producing those nutrients that actually rebuilds disc and cartilage. It stops doing that about age 40. So that's great that we're getting nutrients, getting the process that would allow nutrients to come back in. But if your body doesn't have those nutrients anymore, what a surprise, you're going to see that degeneration continue. That's why it's so important to add step number 3, is we can actually give you the exact nutrients you need on so many different levels. They're going to help to rebuild the disc. We can give you ones that will actually help to start to heal the nerve. We can give you natural anti-inflammatories. We can have ones that are going to deal with muscle spasm. We have ones that will actually ease all the pressure and burning on the nerve as well. These are all natural nutraceuticals. It's one of my specialties. I have a fellowship in vitamin supplementation. You need to be specific to what's going on with you. So please don't think you can go to the Costco and the Shoppers and just buy the joint formula. That may or may not have benefits to you. You need to be specific, but it's the nutraceuticals. You need them in your body. You need those supplements and nutrients so that you can actually start to rebuild that disc and cartilage so that you can bring down that inflammation. Step number 3 is one of the key components of the 7-step protocol. Step number 4 is also critical. It's what we refer to as spinal neurological correction. So what that is think about it. If we have vertebrae that are subluxated, if they're jammed up, if they've lost their normal movement and function, the biggest thing they're doing is they're obstructing that normal nerve function. So spinal neurological correction, as a neurofunctional chiropractor, this is something specific to what we do, where what we want to do is we not only want to we don't just want to realign vertebrae, and this is done through a very safe, very skilled procedure. What we want to do is we want to restore normal function. That's not only normal movement, but also normal nerve function as well. So think of this in the sense that if the non-surgical robotic laser spinal decompression is doing the big movement, think of the spinal neurological correction as more the fine-tuning of that. And that, again, that's essential. If you have pressure on a disc herniation, the smartest thing in the world you can do is to do spinal neurological correction in a direction that takes pressure off that disc. Not smartest thing in the world to do would to do that in a direction that puts pressure back on that disc. So again, you see how all of the steps are tied back to one another. That's why step number 1 was so important, is to actually know exactly what's going on, know all of the underlying causes of the problem. That's going to make a huge difference between your success and your lack of that same success. Step number 5 in our 7-step protocol of our neurospinal restoration program is what we call muscle fiber restoration. So here's the thing. If you've had this for years, then understand those muscles have not just most likely become weak or strained, but you've literally changed the texture of those muscle fibers. The best way to probably explain it is, let's say you actually cut your forearm and a scab would form over that part of the cut. And when that scab was there, if I actually tried to stretch or move that part of my skin, obviously that skin's not going to function or move the way it should be. But eventually that scab will fall off and that will come back to normal. Think of this same thing happening on the inside of the body, but instead of coming from a cut, it's going to come from repetitive strain or old injury. And instead of calling it a scab, we're going to call it a fibrous adhesion, or if it's been there long enough, it's going to turn into scar tissue. And now appreciate that if you have muscles or tendons that are actually scarred together, well, every time your brain says, let's move this one tendon or muscle, it can't really do that because it's actually stuck to something else. Or when it does that, it's going to abnormally pull on a muscle or tendon that wasn't meant to be pulled on. Understand all these muscles and tendons actually attach to bone at either end, so you're going to get abnormal movement or pulling on the bone. And also appreciate nerves even course through there as well. So with every muscle movement, you may in fact be getting muscle tension on a nerve. You need to restore that proper muscle fiber elasticity, and that's why often people will try to stretch to no end, and they're not seeing those same results simply because they've actually scarred or adhesed all that muscle tissue. That's why the muscle fiber restoration is a key component as well. Step number 6 in our 7-step protocol is what's called neuromuscular reeducation. Now appreciate this is different than what we just talked about with the muscle fiber restoration. This is about getting your brain to learn how to use its muscles properly again. So this goes way beyond exercise. For those who don't know, I used to be the director of rehab at the Sports Science Center here in Ottawa. I have the privilege to have taken care of some of the world's best athletes, including previous world's fastest man. I tell you this because I'm a bigger fan of exercise than anyone, but when we get to neuromuscular reeducation, this is not simply strengthening your core. And it's one of the things that a lot of people who suffer with lumbar spinal stenosis, with this type of back pain, they're almost shamed into being told that they're lazy. They're told by so many people, oh, go just strengthen your core. And appreciate, again, I'm a bigger fan of exercise than anyone, and yes, it is important to strengthen your core. But think about it. If you have, for instance, a disc herniation that's putting pressure into that spinal canal, the last thing in the world you want to do is go do some exercise that puts more pressure on that disc herniation or puts more pressure on that spinal canal. That's not going to help you. That's just going to hurt you. And those are the people you see who are making efforts to do basic exercise and they're not getting the results. What neuromuscular reeducation is all about is getting your brain to literally get those networks, those neural networks, those connections to work properly again, because you've developed what we call faulty movement patterns. And the longer you live with this, the more the body's trying to make the best of a bad situation. So it's going to compensate, but it doesn't always do that in the best way. It does it the best way it can, but it's still a bad situation. So neuromuscular reeducation, again, has to be specific to you and at its appropriate place and time. That's why, sure, you can go and there are some good lumbar spinal stenosis exercises, but they may not be appropriate for everyone. Again, this comes back to where step number 1, doing the comprehensive initial consultation and exam, is so important. And you notice how all 7 of the steps are intertwined. Okay? They all support one another as well. So again, you've got to be specific and exactly getting your body to function back the way it should be. And this finally leads us to step number 7. So what is step number 7? Well, step number 7 is when you use a 7-step protocol like this, when you're as specific as you can be, when you determine all of the underlying causes of the problem and how the body's changed and adapted and compensated and so forth, then you see the best results you possibly can. But you want to monitor that. Think of how many people who've suffered with lumbar spinal stenosis for 5, 10, 20 years, and they're under the care of some healthcare professional. And that's not at all, again, to bash the healthcare professional, but at some point in time, you have to say, is this actually working? Okay? The idea that you're managing something, managing a condition, that just means that you're going to have the condition for the rest of your life, and you're trying to minimize the pain or the dysfunction. And the problem with that, if that's done through drugs, is that the process is going to continue. Understand, there's no drug in the world, that will mask pain, that is also preventing the degeneration from progressing or preventing, possibly a spondylolisthesis from continuing to slip. That's the problem with going the drug route, is you're masking the pain. You're not holding it at bay. You're actually allowing it to get worse. So what step number 7 is all about is we don't want anyone to ever do one of our programs and then just cross our fingers and hope. So step number 7 is a progress reexamination. All those same tests that we did on step number 1, on day 1 when you first came in, those don't just serve as a proper way to finally diagnose what your all of the underlying causes are. They also serve as a baseline so that we can see your function improve. So step number 7 in our case, we'll redo a full spine nerve scan. We'll redo our diagnostic digital x-rays. We'll redo our ranges of motion and look at pelvic imbalance and look at orthopedic testing and look at disability indexes so that we can be sure that functionally you're getting better. And the goal here is functionally. Okay? Do we want you to feel better pain-wise? Absolutely. And do the vast majority of our patients feel better pain-wise? Absolutely as well. But we don't just want to focus on the pain because, again, that could be temporary. If we correct the underlying causes of the problem and actually improve function, that is the best and the fastest way to not only get rid of the pain, but to, in fact, ensure that you can get back to doing the things that you want to do. And so, again, every health professional, any program you're on anywhere, should be doing this. It should not be something where 2 years down the road you're the exact same person or you've progressed nowhere. Is for most of our programs range anywhere from 2 to 10 weeks, but for a lot of our patients, it's an 8-week program. 8 weeks down the road, we're actually doing a progress exam again. We're actually seeing the improvements you've made, so we can show you not only that you've gone from A to B, so that we're ensuring you're getting long-term results, but it's also a great way to know where to go from there as well. After, for instance, in Lou's case, after an 8-week program, is it something where he still needs more improvement? Is it something where we've achieved exactly what we wanted? Is it something where you want to maintain? The only way to know that is to do the exact same thing we did day 1, is let's find out exactly what's going on. You combine all 7 of these steps and the changes that we see in our patients, especially for lumbar spinal stenosis, is amazing. It's life-changing. I hope this video gave you a better understanding of how to treat lumbar spinal stenosis in a comprehensive step-by-step process. Now I want to hear from you. What's been your experience with lumbar spinal stenosis treatment? What's worked for you? What hasn't worked for you? Did you get all of these 7 steps or not? Let me know by leaving a comment below. If you found value in this video, go ahead and give it a like and also share it so more people can learn about this 7-step process for treating lumbar spinal stenosis without surgery and without drugs. If you're curious to learn more about the unique and revolutionary robotic laser spinal decompression method, go watch this video right here where I go into more detail about it. Go watch the video right here.